A native of Alliance, Ohio, James A. Obney, M.D., has become renowned as a leading expert in cardiovascular healthcare, especially in the practice of coronary bypass surgery, heart valve surgery, lung cancer surgery, and robotic lung surgery. He was initially drawn to his field by his own medical crisis, having undergone surgery at the esteemed Cleveland Clinic in his teenage years that required an 8-day hospital stay. During this time, Dr. Obney witnessed the experience of other children and adolescents who had the same medical procedure, which shaped his ambitions toward a career in medicine. Dr. Obney initially pursued a formal education at Case Western Reserve University, from which he earned a bachelor's degree in 1989. He continued his studies with a Doctor of Medicine at the Medical College of Ohio in Toledo in 1993. Soon thereafter, he enlisted in the U.S. Army, a tenure during which he simultaneously furthered his academic efforts through the Healthcare Scholarship Program. Refining his skills at the Brooke Army Medical Center at Fort Sam Houston in San Antonio, Texas, Dr. Obney completed a residency in surgery between 1993 and 1998, and a fellow in thoracic surgery between 1998 and 2000, both as part of the San Antonio Uniformed Services Health Education Consortium. Over the course of his 13-year service in the U.S. Army, Dr. Obney was sent to the front lines of Operation Iraqi Freedom, having been deployed alongside the 874th Forward Surgical Team in Kirkuk, Iraq in 2004. His efficiency in this role led him to be transferred to the 67th Combat Support Hospital in Mosul, Iraq, returning to the United States after a year overseas. Prior to his retirement from the U.S. Army in 2006, Dr. Obney proudly achieved the rank of Lieutenant Colonel. Upon re-entering civilian life, Dr. Obney witnessed a reduction in volume at military training hospitals after the introduction of TRICARE, a healthcare plan for military beneficiaries. As a result, he was recruited to work as a cardiac surgeon at the James A. Haley Veterans Hospital, part of VA Tampa Healthcare in Tampa, Florida, in 2006. Throughout his 6-year tenure at the aforementioned hospital, he notably advanced to the position of Section Chief for Cardiac Surgery. Moreover, Dr. Obney was simultaneously recruited as a clinical instructor and resident supervisor within his discipline at the University of South Florida before relocating to Texas to enter private practice. Between 2012 and 2022, Dr. Obney found success in the United Regional Healthcare System, practicing as Section Chief and Deputy Chief of the Surgery Department. Having previously garnered his certifications from the American Board of Surgery and the American Board of Thoracic Surgery, he completed 9 months of additional training in robotic surgery to build upon his unique skill set. Throughout his career, he would also obtain a number of licenses to practice medicine, including in West Virginia, Florida, Texas, and ultimately Ohio. Beyond his primary responsibilities in the United Regional Healthcare System, Dr. Obney decided to expand his wealth of knowledge to include medical law, graduating from the Texas A&M University School of Law with a Master of Jurisprudence in Healthcare Law, Policy, and Management in 2022. Since 2017, Dr. Obney has excelled as a staff cardiothoracic surgeon with the Mount Carmel Medical Group in Ohio, where he established the groundbreaking robotic lung surgery program that is utilized on a daily basis. He has utilized this program in his position as a staff physician with the Fairfield Medical Center since 2023 as well, citing this achievement as a highlight of his decade-spanning career. In addition to conducting multiple surgeries per week, he also conducts rounds with his team and personally visits patients to provide them with their post-operation consultations. Dr. Obney's commitment to his field also extends to his affiliation with such organizations as the American Heart Association, the Florida Society of Thoracic and Cardiovascular Surgeons, and the Society of Thoracic Surgeons. Attributing his success to the outstanding work ethic instilled in him by his parents, both of whom were accomplished educators in their own right, Dr. Obney was honored with a Medal for Distinguished Public Service from the U.S. Department of Defense in 2021. He was also greatly influenced by many mentors in his industry, including Colonel R. Russell Martin, Dr. David J. Cohen, Dr. Reginald Peniston, and Dr. Arthur Larson, who provided him with invaluable training and guidance in his professional development. Emphasizing the importance of humility and the willingness to listen to the next generation of cardiovascular and thoracic surgeons, Dr. Obney believes his greatest accomplishment in life has been fatherhood, having raised 2 wonderful children.